Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Venditti, our hospital director. Today is day 31, Incident Command, giving you the update from Albany Med on the coronavirus. We'll begin with numbers in the 5 counties of positive patients for COVID-19, Albany, Schenectady, Rensselaer, Columbia, and Saratoga. Yesterday, that number was 753. Today, that number is 794. So we've had an increase of about 40 cases in those 5 counties since yesterday. Inside here at Albany Med, the number of patients who are currently being treated for COVID-19 is 66. You'll recall yesterday was 60. So what happened? We admitted 1 patient from the region yesterday, which is very interesting. We discharged 5 people yesterday, and in fact, we discharged 7 people the day before, and we're scheduled to discharge 6 more today. So we're getting a lot of discharges from that population of people who do not need the ICU. Of those 66 people who are in the hospital, we have 29 on the floor, we have 37 in critical care, and of those, 32 are on ventilator. So Fred, we talked about this. There's 2 populations. There's the population that goes to the floor. Most of them are a day or 2. Then there's a group in the ICU.
That's right. And the ICU patients, by and large, wind up on ventilators, and they can be on ventilators for 15 or 20 days before they get better. Interestingly enough, we've extubated a couple of patients, and their length of time on ventilators has been under 10 days.
That's great. Let's go back. So we mentioned we had 1 person admitted yesterday from the region. So we took transfers yesterday. We continue to take the transfers, and I think everyone understands the important mission we're doing there. When you talk about the number of admissions from the region being 1, that suggests something called the doubling time. So Fred, what is doubling time?
So doubling time is the number of days it takes for the cases to double. So if we had 100 cases today, and a week from now we had 200 cases, our doubling time would be 7 days. It turns out that right now our doubling time is around 7 days. Last week when we first started tracking this, it was around 4 days. So it's going up, which means the spread of the virus is slowing.
So a larger doubling time number suggests that what we are doing as far as social distancing and all the steps that people out there are doing is working. And so we're glad about that.
That's right.
Okay. But again, as we said yesterday, 1 or 2 data points is not enough information. We need to keep watching that very carefully.
Keep doing all those good things.
Okay.
Stick with the social distancing, wash your hands, avoid crowds.
Very good. Now, we mentioned the transfers yesterday, and today we're wearing shirts from Health Information Management. If you could read the back of the shirts, it says, connecting people, systems, and ideas. When we take transfers, especially from hospitals that are downstate, that we don't normally get transfers from, the information on those patients has to be passed up to us. And our health information management team plays a really critical role to make sure that we have accurate information on their problems, their medications, and what's transpired. So we thank them.
We thank them. Absolutely. They're doing a terrific job.
Let's talk about resources. We spend a lot of time, Fred, talking about the resources we have here, but there's a level beneath that, the resources behind the resources. So let's talk about 2 of them. We talk a lot about ventilators, and we know we have an adequate number of ventilators, but ventilators run on medical gases like oxygen. Do we have enough oxygen to care for the patients?
So you're absolutely right, Dennis. You need oxygen for ventilators and for oxygen masks as well. Now, we have 2 large tanks in the back by the P building. Between them, they actually have 14,400 gallons of oxygen, liquid oxygen. A gallon of liquid oxygen translates into a little over 1,000 liters of oxygen air. So we have absolutely adequate amounts of oxygen, and something that we keep track of.
Keep track of. Very good. Let's talk about the resources in pharmacy. We have an incredible pharmacy department here. They serve many roles. People may not understand that pharmacists are actually part of the care team on the floor. So in our critical care units, the doctors and the nurses round with pharmacy doctors, yes, and they're experts in providing care. They're helping us with recommendations of medications, including the hydrochloroquine and the Zithromax, which are obviously medications we've heard that have been used to treat COVID-19 patients. But in addition to that, they're doing a lot of work as far as making sure that there are other medications that are available. So I think you want to talk about that.
Again, these are the resources behind the resources. So when someone's on a ventilator, they need to be sedated, so we need those kinds of medications. We frequently paralyze them, so we use paralytics anxiolytics or neuromuscular blockers. And so those are very, very important drugs when we're taking care of patients on ventilators. And they've done a tremendous job sourcing those, making sure we have adequate amounts of those medications.
And we've heard that there's some shortages out there, so the fact
Yes.
that our team is getting them is a credit to them and means that we can continue to do all of our missions.
That's right. Like many things, we've been on top of this. We've been looking down the road a little bit, and we are procuring the amounts we need.
Great. Last topic today. We had talked last week about how many healthcare workers we've had who tested positive for COVID-19. And I think we're due to give an update on what that number is and what the status of those employees are.
So Dennis, I want to start by talking about the total number of employees we have. So here at the Medical Center, we have 10,000 employees, 10,000 people who work for the Medical Center. So as of today, 67 of them have tested positive for COVID. Of those 67, about 2/3, just like the last time we reported this, acquired those infections out in the community. So they were not exposed here in the hospital, rather they were exposed someplace out in the community, and that's where they contracted the illness. Several of them, 4 as a matter of fact, have been sick enough to be hospitalized, but none of them in intensive care, none of them on ventilators, all of them discharged and home now. And 1/3 of our employees who contracted this illness actually are back to work because they've recovered and they're healthy enough to be back on the front lines helping us care for patients.
All right, that's a great update. Thank you
It
very
is.
much.
It's tremendous.
So a lot of good news today. So in summary, the admissions from the region are slowing down. We're going to keep a close eye on that. The Medical Center is still prepared to take care of any patients who need to be sent in to us, thanks to our great staff. The social distancing that everyone is doing is increasing the doubling time, which is remarkable news. So keep doing everything that you're doing to help with that. So that's our update for today. As always, we thank you very much for everything you're doing. We ask that you please take care of yourself, take care of each other, and we'll see you tomorrow.